Now that we have no savings and don't make enough, we qualified for Medicaid. If we don't have that, what is to become of us? My mother had Alzheimer's. My brothers and I cared for her in our homes for about 8 years, but eventually she had to go into memory care because she started to wander around outside. Memory care cost $9,000 a month and her savings were soon exhausted. Medicaid paid for a year of her memory care before she died. Otherwise, one or all of us would have had to quit our jobs to care for her, and we would not have been able to afford that. My husband and I spent the last 3 years spending our savings in retirement on Blue Cross Blue Shield for our family plan. We have one child on it. At the same time, we didn't qualify for the ACA subsidy. In 1 year alone, we spent $54,000 on insurance. That's $4,500 a month on a plan that would give us enough coverage, but with still high deductibles. Now that we have no savings and don't make enough, we qualified for Medicaid. If we don't have that, what is to become of us? My sister is disabled, can't work, and depends on her Medicaid benefit to manage her health care issues. Without it, she will not be able to continue to care for herself. My mother depends on Medicaid to cover her medications. And without long-term Medicaid, my father would not have been able to live out his last year of life in assisted living. He was no longer safe at home and didn't have any other long-term care insurance coverage. My parents dedicated their working lives to educating young people. They were not slackers. They both worked and raised my sister and myself. They chose a profession that doesn't pay what it's worth. And because of this, they needed to supplement their insurance with Medicaid. Healthcare is far too expensive for the average individual to afford without insurance. We are a working family. I'm a manager at a small nonprofit, and we can't afford to offer health care to our employees. At home, we rely on the insurance exchange for our insurance. It would otherwise cost more than our mortgage. Our kids were on Dr. Dinosaur. It was a godsend to deal with my son's congenital heart defect and my daughter's malformed jaw. Both children were able to get the medical care they needed without our hardworking family going into medical debt. As an EMS provider, I think that not enough attention is being paid to the cascade effects of Medicaid. If billions of dollars are cut and millions of Americans go uninsured, that impacts EMS, which gets more than 60% of the funding for ambulance service billing via these programs. Most every EMS agency in Vermont is bankrupt if it goes away. I'm a counselor who works with youth in schools here in Vermont. The majority of the kids I see are in Medicaid. My work with them helps them stay alive in school and off of drugs, allowing them to be productive members of our community. Providing youth with the medical and mental health care that they need saves taxpayer dollars and benefits everyone. I can't begin to fathom the negative and costly consequences of cutting Medicaid for generations to come. These are real stories from real Vermonters, some who depended on Medicaid for their own well-being and health care, others whose parents depended on it. It's kids who were sick, it was adults working who were sick, and it was seniors who had memory care issues or needed a nursing home. I don't, for the life of me, understand why we would be voting on legislation that would literally take away health care for all these Vermonters. We need to defeat, we need to kill the big beautiful bill.